Okay guys, let's discuss about treatment of leprosy. So we have passive bacillary and multibacillary leprosy, and passive bacillary includes tuberculoid and borderline tuberculoid. In the previous videos we discussed that Redley and Jobling gave a scale to measure the spectrum of leprosy, and we discussed leprosy into 5 types. They were tuberculoid, lepromatous, borderline tuberculoid, and borderline lepromatous. So passive bacillary consists of tuberculoid and borderline tuberculoid. So for the treatment of passive bacillary lesions or leprosy, we use Dapsone 100 mg daily. Daily with rifampicin 600 mg once a month, and the duration is for 6 months. Okay, but in case of multibacillary it's different. So multibacillary Dapsone 100 mg is used daily with clofazimine 50 mg daily, and rifampicin 600 mg once a month. The duration in case of multibacillary is long. The medication is done until either for 2 years or until the smears become negative. Until I guess you cannot see this. Oh. Six mg once a month until the smears are negative. Okay, and multibacillary includes lepromatous, borderline, and borderline lepromatous. Okay guys, I guess you cannot see because of the markers are not working properly, so sorry for that. I'll repeat it once. Multibacillary lesions include lepromatous, borderline and borderline lepromatous, and the treatment is dapsone 100 mg daily as in passivicillary, clofazimine 50 mg daily which is an addition, and rifampicin 600 mg once a month until the smears are negative, or sometimes for 2 years, but until the smears are negative. This is until the smears are negative. Okay, smears are negative. And in case of passivicillary lesions, they include tuberculoid and borderline tuberculoid, and the treatment is dapsone 100 mg daily with rifampicin 600 mg once a month for 6 months. So this completes the treatment part. So we discussed, while discussing about the immunity, that there are two types of reaction, that is type 1 reversible reaction or lepra reaction, and type 2 reaction or ENL, that is erythema nodosum leprosum. So we shall discuss about these two types of reactions in a comparative way. So I'll draw a table.